The Gates Foundation announced a new $2.5 billion pledge through the year 2030 for women's health initiatives across the globe. It comes at a time when the Trump administration is cutting major research and aid directed at women and maternal health. Amna Nawaz spoke recently with the point person about the goals of this new funding.
Dr. Anita Zaidi is president of the Gates Foundation's Gender Equality Division, and she joins me now. Dr. Zaidi, welcome to the NewsHour. Thanks for joining us.
Thank you, Amna. Thank you for having me.
So this new commitment of $2.5 billion for women's health over the next 5 years is focused on 5 areas. I'll tick through them quickly here. Obstetric care to make pregnancy and delivery safer, maternal health and nutrition, gynecological and menstrual health, more accessible and effective contraceptive options, and better diagnosis and treatment of STIs, or sexually transmitted infections. So why these 5 priorities? What's the overarching goal here?
So, Amna, this is when we looked at all of the data that is there for women's health and what it is that it causes a lot of problems around the world. These were the areas that had 3 things in common. One is they are a huge burden and unmet need. 2 is that they are very neglected from an R&D perspective. And 3 is that low cost, affordable innovations that can be available in the near term horizon are possible for many of these issues.
You said also these are going to particularly affect women in low and middle income countries. We should point out your background was in pediatric care in Pakistan. Can you just give us an example of the kinds of things that you would see that tells you these investments make a real difference? Give us 1 or 2 stories.
Yes. So how often, for example, women don't get cesarean sections in time because we don't have the right tools to diagnose when she needs a cesarean section, or unnecessary cesarean sections are done because we guess wrong. And that's a problem actually that women face all around the world. But I used to see this all the time, that a cesarean section was delayed because you did not know that this woman actually needed to be in a hospital that was far away. And so one of the things I think which would be the most transformative and which we will see come out sooner in the next 5 years is going to be what we can do with artificial intelligence to be able to really understand when a woman really needs a cesarean section for a safe delivery.
We should point out, too, these are areas that have long been underfunded. There was a 2021 study that found just 1% of healthcare research and innovation is invested in female-specific conditions outside of oncology. Just 1%. Why is that?
Yeah, so that's a really good question. Now, there's several reasons. There is a systemic issue, structural in medicine, where the male body has been the default body. And so the assumption is that whatever works for men also works for women. But there are fundamental biological differences between men and women that need different solutions. And 2 is that many areas, such as pregnancy, are considered very high risk for research. And so often the thing has been you leave pregnant women out of a lot of clinical trials. And what that has resulted in is the situation where we actually now don't have medicines that we can use if a pregnant woman develops a problem. A very big example of this, which is a problem that pregnant women face around the world, is preeclampsia, which is hypertension during pregnancy. Preeclampsia has no treatment anywhere around the world.
There's also been reports that look at how the money invested in women's health pays dividends more broadly in society. Is this just about investing in women's health?
Well, so when you work in low resource environments like I've worked, you very quickly see the connection between women's health, children's health, and family health. And so I would say one of the most profound lessons I learned by working in communities is how children cannot thrive if women are not thriving. And those things are extremely closely related. And in fact, if we want to decrease child mortality around the world, you really need to focus on women's health.
We're also speaking at a time when you've seen the U.S. government pull back from a lot of foreign aid funding it was doing, dismantling health programs right here in the U.S. and making it harder, a lot of people argue, to access things like family planning and maternal health care. How much did all of that inform this investment right now?
So they're not connected. I would call this investment a foundational pillar of the Gender Equality Division at the Gates Foundation. And I'm just really proud to be able to share this commitment. It's the largest commitment that the foundation has ever made to any particular area of R&D. And we chose the 5 years for a good reason as well. One is that I think that this is a unique opportunity to accelerate progress for women's health because so many AI has made so much faster progress possible. And two is that it's a short enough time that I want to hold myself accountable to be able to deliver on the promise. So that's the 5 years. No foundation or groups of foundations can match the funding that the US government has historically provided for fighting disease, hunger, and poverty around the world. And our hope is that this investment can catalyze attention and interest from the private sector and from philanthropy.
You've called this 2.5 billion just a drop in the bucket to meet the need that's out there. What needs to happen?
Yeah, so it seems like a big number, and it is a big number, $2.5 billion for the next 5 years for women's health innovations. But for what the need is, it's a drop. It really is a drop in the bucket. And we really are hoping that this announcement sparks interest from a lot of other funders, innovators, private philanthropy, private sector, to come in and see that this is not just the right thing to do, but there's a tremendous opportunity for coming up with new solutions in a very exciting area of science.
That is Dr. Anita Zaidi, the president of the Gates Foundation's Gender Equality Division. Dr. Zaidi, thank you. Such a pleasure to speak with you.
Same here. Thank you so much, Amna.